Good morning, good afternoon, and good evening. Welcome to the 551st day of continuous Zoom session IFPH. Today, our guest is Dr. Narayan Debnath, Principal in charge, Dr. J.K. Saikia Homeopathic Medical College Hospital, Jorhat, Assam, India. Dean, Faculty of Homeopathy, SSUHS Assam, former executive member, Central Council Homeopathy, New Delhi, with more than 25 years of experience. The topic is Beauty of Homeopathy in Children's Disease. On behalf of IFPH, I am welcoming you, sir. You can have a pattern for the next 40 minutes. It's over to you, sir.
I heartily welcome all the participants from different corners of the world. My earlier topic was the beauty of homeopathy in children diseases, and last time we could not continue due to network issue. I would try to continue my earlier topic. This part we already discussed: neonatal jaundice, umbilical sepsis, vomiting, diarrhea related. Now, even we discussed in earlier respiratory disorder in children. Next is constipation. What happens? The parents generally become very anxious when baby does not pass stool even a day, or if the baby pass stool mild or semi-solid stool 2-3 times, then also parent become anxious. But in young infant, it can be normal, heavy, of not passing stool for 2-3 days, or may pass stool many times in a day. The main factor is parents should be educated in this topic, and if our doctor feels it is necessary to give the medicine and baby suffered from other discomfort related to the constipation, then he may think of medicine. But common cause of constipation is anal fissure, which causes pain in the anal region, for which the baby may fear for passing stool, because while passing stool, baby suffered from pain. Another important cause is cow milk protein intolerance in case of baby. Worm present in the intestinal, which causes intestinal obstruction. Excessive worm depositing in the intestinal canal may produces intestinal obstruction. Then the baby may suffer from constipation. Next cause is low fiber diet, poor fluid intake, malnutrition, baby in playing habitual, অর্থাৎ baby habituated in matter relating to its playing, etc. And when it has been also observed that sometimes baby intentionally do not pass stool. When the urge come, they always try to prevent it due to many reasons. But our homeopathic medicine, frequently used medicine in our system of medicine, is Aloe Socotrina, alumina, ammoncar, bryonia, calcareous, chelidonium, causticum, graphitis, lycopodium, magnesium mure, natrium mure, nitric acid, Nux vomica, platina, plumbum, opium, silicea, thuja, nyctanthes, arbortitis. Out of these, most frequently used medicine is alumina, bryonia, Nux vomica, platina, plumbum, opium, silicea, sulfur. In case of alumina, the most baby suffered from constipation due to artificial food, or we may call artificial bottle feed baby. They suffer from constipation, and the main indication or cause of their constipation is paretic condition of lower intestine, for which the baby suffered from constipation and they do not feel any urge for passing stool. And in case of bryonia, the most cause of bryonia constipation is related to the dryness of its intestinal canal. And ultimately, due to dryness of intestinal canal or all mucous membrane of the body, the baby suffered from dry, hard stool as if burnt. Along with this constipation, we may go to the other symptom of bryonia, general characteristic symptom of bryonia. If we get other symptom of bryonia, then it would act miraculously. The next important medicine is Nux vomica, wherein we will get the most important symptom related to the bad effect of excessive medication of different systems medicine, or we may call bad effect of excessive use of modern medicine and quack medicine. Here we should remember one thing, that when Nux vomica fails, platina works, and when platina fails, plumbum works best. This indication we should also remember for treating the constipation of children, and we will get similar symptom whatever we got in bryonia. Similar symptom we will get in sulfur: stool dry, hard, as if burnt, and for which, due to dryness, hardness, and as if burnt symptom, when bryonia fails, many cases has been observed miraculously worked by the sulfur. Next important medicine is alosocotrina. The parent will complain, parent will anxious that the baby does not pass stools since last 10 days. Even you may got such kind of comment of the parents, baby does not pass stool since 15 days, 3 days, 2 days, 1 day. When the baby does not pass stool for many days, say for 10 days, but the baby all work related to the physical and mental, eating habit, everything is normal, then you may think of calcarea curve, as it is noted in our Allen's keynote, feels better during constipation. That means baby suffered from constipation, but his or her food habit or mental, physical other symptom is absolutely normal. Then we may think of calcarea car. But when baby does not pass stool 1 or 2 days, which I told, it is normal. It is normal not according to the me. It is normal according to the practice of medicine written in the modern system of medicine. When baby does not pass stool for 1 or 2 days and baby suffer from his dissatisfaction, mental agony, etc., then we may think of aloes socotrina. Another important medicine is causticum, where the baby passes stool better while in standing position. The most indicated symptom of causticum. Baby pass stool better in standing position. I have experience of curing many cases. The baby suffered from other suffering for which parents are anxious. It may related to the any part of the body from head to foot, we may call. But baby having this indication, they pass stool better while standing, only on the basis of this single symptom, although it was not good practice. At least 3 symptoms of any medicine, characteristic symptom required for prescribing any medicine according to Dr. E.B. Nash. But without getting any other symptom, only on the basis of causticums, this symptom I have cured many cases, not only related to the constipation, even other symptom, other trouble of the baby. In case of hard stool dry, hard as if burnt, or stool like ball-like stool, this indication also has been found in Chelidonium, opium, and plumbum. Chelidonium, opium, and plumbum. That also we may or we should remember. The other important medicine is for constipation, magnesium, metramine, etc. Next, I will try to discuss about ophthalmia neonatorum in case of children. Purulent conjunctivitis in newborn developing within 21 days after the birth, but in many cases it has been seen or observed that soon after birth also the baby suffered from purulent conjunctivitis. The main cause of this purulent conjunctivitis is infection related to the birth canal, and it is better to say if the mother suffered from any disease like gonorrhea and syphilis or sexually transmitted disease, then the baby may affect from this purulent conjunctivitis, or we may call it ophthalmia neonatorum. The most important remedy, frequently used medicine in my practice, I have observed 2 medicine. Number 1 is mercurius, and the second one is argentum nitricum. Most frequently used medicine. The other medicine is pulsatilla, thuja, creosote, and arsenic album. But these medicines should be used on the basis of symptom similarity. In many cases, it is difficult to get the symptom from the patient, not from the patient herein. It is better to say symptom from the parents. In those cases, I would suggest where the symptom indication is not possible for collecting properly, I would like to request my colleague in those cases only, you may try with mercurius and argentum nitricum, where we are hopeless in terms of collecting symptom or symptom described by the patient is not proper. In those cases, you may try with mercurius and argentum nitricum. And I have cured many cases with these two medicine. But if we got the symptom properly, the next important medicine, I repeat, arsenic and pulsatilla creosote thuja. Infantile colic. The pain in abdomen manifested by crying lasting for longer than 3 hours a day or 3 days in a week for months, usually seen during evening hours after about 6 weeks of age. And the difficulties in treating homeopathically in the infantile colic is the baby could not or infant could not express its symptom related to the modality, cause, etc., etc. In those cases, we are helpless, but we are not hopeless. If we observe the baby properly, and if we have or we can gain the knowledge of Materia Medica, we shall success definitely. The more common cause is bottle feed babies. Number one, underfeeding and overfeeding. Some babies suffer from milk allergy also. These are the most important cause, and excessive air swallowing during feeding. And the most commonly used medicine is, I have seen chamomilla, gelapa, soranum, macphos, belladonna, colocin, aconite, pulsatilla, ipecac, most common. It has also observed that many a physician, when they are not able to select medicine on the basis of symptom similarity in the term related to the infantile colic, they blindly frequently used Cataria nipeta and Senna. But herein one spelling mistake is there. It has written by mistake Japapa, but it should be Jalapa, Jalapa. In case of Jalapa and Soraina, baby cries all night and plays during the day or sleep during the day very quietly. Only this indication help us to select Jalapa or Soraina. And when the baby cries all the day, sleeps at night, then we should think of Lycopodium. And the rest of the medicine related to the infantile colic, two important medicine is pulsatilla and chamomilla. As the baby could not express any symptom or describe any symptom, only symptom, objective symptom helps us to select the medicine. In case of pulsatilla, the main indication is pitiful cry. Pitiful cry. Pitiful cry means when the baby will cry, anyone standing or sitting or in any position staying near the baby or in the same room, his or heart would be broken towards the baby. That means this pitiful cry means uh, that it craves sympathy or craves consolation, or expression is very mild. But in case of chamomilla, baby will cry in this way. Even parents will say the baby should die. It is better to die. That is intolerable sound. With intolerable sound, baby will cry. Ah! Ah! In this way, with high volume, you can say. No one can tolerate the sound of that cry. But in case of pulsatilla, the most enemy will be sympathized to him or her after observing the scenario or after seeing the scenario, whatever you may think. Next important is McPhos and Colocin. Only with one symptom, we can differentiate whether it is for McPhos and Colocin. In the book, there would all of would get lots of symptoms written in the Materia Medica in case of McPhos and Colocin. But for the main differentiating point is McPhos relieved by giving pressure and heat. In many a time, we have seen when we are in or at the age of, you may call 7, 8, 10 years, we have seen when the little baby cries, the parents generally give some pressure in the abdomen or apply cold application by putting cold water in a glass. They put it baby's abdomen, or sometimes by putting hot water in the glass, they give it in pressure way into the abdomen. In case of colosine, if the pain better by giving pressure in the abdomen. But in case of MACFOS, it also having the symptom better by pressure, and in adult we may call by bending double. In case of MACFOS, the additional symptom for differentiating point is the pain better by heat application and pressure. Both heat application and pressure equal to MACFOS, and only pressure equal to colosine. By this way, we may differentiate this colosine and MACFOS. And in case of belladonna, the pain comes suddenly and violently, along with the baby's redness of the face. In case of belladonna, the baby's face would be red, and in case of aconite, the baby's face would be the anxious and fearful. By these few symptoms, we can differentiate belladonna and aconite. Next, topic is diaper rash. Inflammation of skin found in the diaper area in infant and young children involves buttock, scrotal sac, mons pubis, or inner thigh. The most common cause is poor peritoneal hygiene. Poor peritoneal hygiene is the most common cause for diaper rash. The most common and frequently used medicine is belladonna, borax, graphitis, arsenic, rustox, sulfur. Obviously, these medicines should be differentiated on the basis of its indication or on the basis of its other general symptom. Slide change kore jabe. Although it is not related to the directly with the diaper rash, I would like to show you a case of an infant related to the skin symptom. Herein, I could not make the slide in proper arrangement condition due to shortage of time. Suddenly, it came into my thought that this case may be shown you. A case I have seen in 2nd January 22. The case is of, you can say, semi-town area. We call, it is better to say semi-town area or rural area also. You see head of the baby and back of the baby, including buttock, and this is also back of the baby. This is also back of the baby. Actually, or truly speaking, the case is not, the photography is not taken in this way that it would be shown in the classes or any seminar. It was randomly taken. And next you see abdomen of the baby. Next, this is also picture of abdomen of the baby. The age of the baby was then 17 days. This was the picture of 2nd January. The most difficulty in case of infant or children treating the case is they could not express any subjective symptom. On the basis of objective symptom, we have to treat the cases. Now, this is the picture of 9th January. And this is also 9th January picture. This is also 9th January. This is of 23rd January. You see, on 2nd January, abdominal condition. On 23rd January, abdominal condition. And 23rd January, back condition. 23rd January, again, abdominal back. This was the picture of 2nd January. I could not arrange properly. Next, 29th January picture of the baby. So this case, in these cases, I was confused what to be prescribed. Confused. There was no symptom except external indication and the baby crying 24 hours. No one can touch it due to this pain, excessive pain. I was confused whether I should prescribe arnica or sulfur or Hipersurf. But suddenly, after making inquiry to the parents, it has been observed that they are staying in damp area. And as the cases of semi-rural area, we may call, there is a tradition in our area. These cases of my practice zone where you can say I go weekly on Sunday only after traveling 200 kilometers. There is a history why I am attending that particular area. You can say in that area I was born. And that is why I have some sympathetic or some emotional relation with that particular area. So lastly, after consulting with parents, I prescribed simple Rastox. And after prescribing Rastox, this was the result. And in this regard, I will like to discuss few other medicine related to the skin. Those who are newly practicing, I would suggest them for any skin disease. For any skin disease. Those who are newcomers, in their early stage of life, if you can remember these medicine, with their proper indication, or rather it is better to say with proper differentiation. If you can remember, this medicine you would able to practice at least 90% of your 90% of your skin disease related cases. First, I will suggest remember simple belladonna, mercurius, hipersal, arnica sulfur. In first stage of your practice or education, I am not discussing this part of the topic is for the experienced doctor who is over here. Don't take it otherwise. This is for the beginner for gaining their confidence. First, remember belladonna, mercurius, hipersal, silicea. Now, in short, I am giving a reference to you. Please go through the Kent Materia Medica in terms of mercurius, hipersal, silicea. If you read these three medicine, you will get a relationship of using medicine in boil, abscess, carbuncle, etc. in initial stages. Next, you go for arnica and sulfur. By the single word, you can differentiate arnica and sulfur in terms of boil, abscess, carbuncle. In arnica, one after another, and in sulfur, one group of boil, abscess, carbuncle appear, and after disappearing, another group will appear. For the other skin disease related, except this boil, abscess, carbuncle, sorry, it would be better to say for next to belladonna, hipersal, mercurius, silicea, please try to read tarantula, arsenic, lachesis, crotalus horridas, and carbolic acid. In case of tarantula, only one indication will help you to prescribe tarantula, that is terrible burning pain or terrible excruciating pain in case of boil, abscess, carbuncle, and within 24 hours, it would be in dangerous condition or it would develop fully. And for same terrible pain, excruciating burning pain, you will get in arsenic album also. But in arsenic album, main differentiative point is better by heat. I would suggest the newcomer, along with this medicine, try to differentiate Cotrellus horridas and lachesis carbolic acid. It will give you a confidence in your practice life. And for many skin disease or whatever may be the diagnostic point of skin disease, if we can get our confidence or we can understood the differentiation between mesoryum, petroleum, sepia, sorinum, arsio, rastrox, and tincrude graphitis, confidently, majority of the skin disease we would able to treat. I would like to request those who are newcomer, please give stress on this medicine. And lastly, another medicine, try to remember pyrogen. Simple indication in case of pyrogen, when this skin disease, sorry, or any skin disease leads to the septicemic condition, whether it is cellulitis or by name any other skin disease, then pyrogen should be thought in first stage. The other medicine is related to the skin is calcareous salve, Myristica sebifera, and even in many cases, calendula also help us for skin related indication if the symptom permits. Our slide. Another medicine can remember related to the bad effect of vaccination. We generally use commonly for bad effect of vaccination related symptom, Antimta, Thuja, Silicea. These three medicine is called, no one called like this. For your understanding, I am calling these three is the three king of bad effect of vaccination. But along with these three medicine, I would request to remember other medicine, namely Measurium and Crotalus viridis for bad effect of vaccination. Many cases I have treated in terms of bad effect of vaccination. It has been observed, I do not know whether other people, other local area, homeopath physician, whether they got it or not, but I have seen many cases bad effect of vaccination in terms of our COVID first dose and second dose. Many people said they suffered from roaring in the ear, they suffered from vertigo. Even some has shown after taking vaccination, first dose or second dose, symptom related to the skin. Some shows abdominal discomfort, some shows temperature, continuous temperature.
Yes,
but
sir.
in many cases,
yes,
I have used two medicine, Thuja and Measurium.
Yeah.
Related to the vaccination, bad effect of vaccination was Measurium and Thuja. Obviously, it was on the basis of symptom of the patient, and with good result. The last slide in terms of today's discussion is somnambulism. Somnambulism means night walking during sleep, simple. And it is commonly seen in 11 or 12 years ages. Exact cause is not known. But in our system of medicine, frequently used medicine is Silicea, Caliphos, and Calibrum. Silicea, Caliphos, and Calibrum are the frequently used medicine. Other medicine is Netramure, Opium, Phosphorus, Aconite, Bryonia. And I would suggest the lovely audience to prescribe this medicine on the basis of individuality or on the basis of symptom similarity. But this medicine is most commonly, frequently used medicine. With thanks, I would conclude my topic.